dedicating our production resources and media platforms
to shine a light on your brand.
Apply now at allinforequity.ca.
Allinforequity.ca.
This is Rogers TV, Grey County.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Hello and welcome to HealthLink, a program connecting home, community, and healthcare. My name is Carol Merton, and today I'm delighted to welcome as a guest Ian Reich, who is a program manager at the Grey Bruce Public Health Unit. Ian, thank you for joining us today.
No worries. Always great to be here.
It is wonderful to have you on the program. And I'm most interested in the topic you're going to be covering. I'm always interested in topics you cover, but really interested in the topic we're going to really target on, and that is about the mobile outreach project. There may be other things we talk about as well, but I'm wondering if you can fill us in. This is a new project, or is it, 2022?
I'll walk through sort of the inception of this project and sort of the really important key players that really made this possible for us here in Grey Bruce. So during COVID, obviously, there's been significant challenges to those that are most in need within our communities, those that are homeless, near homeless, challenged with income, those sorts of things. So back in July, there was a significant concern in the Hanover area at one of the establishments there in Hanover, where we saw a significant need to bring services to people as opposed to having people come to traditional health services. And the reason for that was just the challenges that they were under, not having transportation, but the biggest impact was being isolated due to a COVID infection within that setting. So they couldn't leave. So we had to figure out a way how to bring services to them. So a collection of agencies from Grey County EMS to the RAM Clinic at the Owen Sound Hospital, or Grey Bruce Health Services, Hanover Family Health Team, just a whole group of people came together and ensured that all services were provided to individuals within that setting. So as time progressed, we saw significant positive outcomes from that. But as time progressed and the fall sort of came close, the concern arose again about, well, what happens if this happens again? So really, this person that spearheaded all this was Kevin McNabb from Grey County EMS, who really brought this point forward. And as a result, he was able to assemble a group of partners, very similar partners that were involved in the Hanover Outreach Project, to say, what more can we do? How can we make what we did in Hanover be permanent? How can we make it stay so that those most in need always have access to services that they require? So we started back in October, just a trial to see how can we do this. And from October to present, we've been really testing things in Owen Sound and Hanover to provide basically on-the-ground outreach services to provide a wealth of information and services to individuals that traditionally wouldn't access the healthcare system. So this collection of agencies, basically from Grey County EMS, again, they are spearheading this and they are on the grounds. They are leading the operations on the ground. We've assembled a team to provide medical services. So we'll have physicians or nurse practitioners on site to provide any medical care that may be required for individuals. Addiction and mental health services are also available from CMHA, as well as the Rapid Access and Addiction Medicine Clinic from Grey Bruce Health Services. Then we also provide a huge amount of support services for individuals involving Grey County Housing, YMCA Housing, ODSP, to make sure that anyone that needs support in those sectors has someone right there on the grounds to give them real-time service. And then in addition, we also provide harm reduction supplies and equipment for individuals that perhaps there are folks that are struggling with homelessness that also use substances. But we want to make sure that they have access to all naloxone and safe use equipment, that sort of thing, directly at their veil. but probably one of the most beneficial services, especially in the wintertime, is the availability of United Way and Salvation Army that are on site to provide things like mittens, coats, socks, hygiene packs like toothbrushes, for individuals that are struggling to be able to access these services. And then last but not least, one of the critical components of this is the provision of food and lunch to those that are struggling as well. But each one of these services, or these days, lunch is provided to individuals that do require it. And then I almost forgot, we also offer, the EMS is kind enough to be providing vaccinations of all sorts to those that have challenges getting to perhaps a vaccine hub, a pharmacy, or their primary care providers. COVID vaccines, influenza vaccines, as well as regular boosters can be provided to individuals on most days as well.
Excellent. So you used the phrase which really captured me, that this outreach delivers services for those who most have the need, have access on the ground. I mean, that's almost a mission statement for the service, really, when you think about it.
Absolutely.
Yeah, I mean, it just encapsulates so much. So as you're describing the various services, we've heard the term wraparound services, and we've heard the term no wrong door. Is this an example of that?
Yeah, absolutely. Obviously, it's a fairly small location where we're at, and there's a finite amount of services that we can bring on site to support individuals. But what is really critical here is that these services, one, they establish trust with individuals that typically have not accessed the healthcare system. But two, they also offer that open door facilitation. So making sure that if someone asks for help, even if that service is not necessarily there on the grounds, they're able to ask and we'll make it happen. So we will open those doors for individuals. An example of that is the ID clinic, for instance. We may not necessarily have it directly on the ground. However, CMHA is on site and they can facilitate that connection as needed. Same with ODSP, for instance. They may not necessarily always be on the ground that day, but we can collect information and make sure a referral is made to that service provider.
Yeah. So if you don't mind, just in a little more detail, ID clinic, what exactly does that offer? And then ODSP, I know it's an acronym, but just for those who may not be aware of what it means, if you can just elaborate a bit on that.
Definitely. They're not my sort of services that I operate, but a high level point of view is folks that perhaps need an identification or something like that. They have that service available to them. And then for ODSP, those are folks financially challenged, that sort of thing, that have a caseworker associated, and basically being able to get a basic income and support for many services that are required, obviously, to simply just survive without an income.
So certainly you have to have an identification to be able to access those clinics. And for some, they may not even know how to get their identification, or if something's gotten lost, even how to replace it. So we often take these things for granted, but for them, it's a real showstopper. I mean, it just restricts in so much their ability to get the basic necessities. So
absolutely. And one of the neat benefits of the service is we really want to cater to individuals, again, that don't access health services typically. So they may not necessarily be really challenged in a way, financially or whatever, but for whatever reason, the traditional model of health services just doesn't fit their needs. So this model is available to those as well. So not necessarily being homeless or near homeless or being in really challenging situations, but also individuals that maybe just have a doctor. It's not a walk-in clinic per se, but we want to ensure that folks understand that this is truly there for individuals that typically just cannot access or will not access traditional services.
So fill me in a bit more on the actual details. So is this actually a van, a truck? I mean, where do you go? And, Give me the meat. Give me the details.
There's definitely a long-term vision of seeing something that is truly mobile, so a bus, a van, something along those natures. But obviously, as we develop changes in the healthcare system, we need to test and prove effectiveness of new initiatives. So, we're offering these services in Owen Sound and Hanover, basically every Wednesday, so on a rotating basis. So Owen Sound one week, Hanover the next, in Owen Sound, it's located at the market, right downtown Owen Sound. So we set up directly in the market itself. Everyone is screened, COVID screening is done. Masks are sort of handed out to anyone that doesn't have access to a mask, that sort of thing. And basically we have multiple tables set up where people can basically stop at each table if they choose, or only go to the table that sort of meets their needs or they have a requirement for. So for instance, a person can expect when they enter, if they're there, they say at the screening table, I would like my vaccine. EMS will then guide them directly to who's giving the vaccine. So we try to screen people and sort of see what their needs are before entering and guide them to where they may want to go. But then there's also some folks that are just there because they want to build that trust. They want to understand what's being offered, and they want to sort of test it out and see how it is. So those folks are free to sort of walk around from table to table and just interact with the different service providers. And what's really, really neat is the service providers work amongst each other to say, if they're talking to someone and they bring up a certain point that maybe is not their expertise, they will then guide them to that table that is providing those services. A perfect example of that is someone coming to the harm reduction table to grab naloxone or some safe drug use equipment, for instance. And in that interaction, the nurse at that table says, oh, I notice that you have a cut on your face, or you have an abscess on your arm, something along those lines. Why don't you go talk to the nurse practitioner? She'll be able to treat it for you. So we're able to sort of get prescriptions written, have the wounds assessed right there on the site, maybe not take care of it, but at least get them involved and entered into the stream that they need to sort of resolve those issues themselves. Same thing for if we're talking to someone and they say, you know what, I'm having real big challenges. I lost a friend not too long ago, and I'm really struggling. And we may be able to say, you know what, CMHA is right here, and they have a mental health person that's able to talk about that and sort of help you through this traumatic situation. So it's an immediate access to mental health counseling, maybe not robust like a sit-down 1-hour session, but it's that touch base, it's that entry into the system so that they can follow up at a later time as well, either through community outreach at our next week mobile outreach service, or directly within the service provider setting as well.
So what's really builds on the strength that I believe we have in our communities, all of our communities, Gray and Bruce, is partnerships. And the linkages and the networking, where it helps all of our residents, because no wrong door. You may start at one door, but then you go to another and another. And so this began early in we're not that far into 2022, but did it start before then, or did it just start in 2022?
So we basically, the group jumped up and said, you know what, we need this, and they started immediately. So it was in October that they actually started trialing this. And then we got involved here at Public Health because what we wanted to do is ensure that we could help the group prove this concept. So basically our role in this was really establishing that team, making sure that all the right players were at the table, obviously with a ton of input. And I'll get to the thanks after this, because honestly, we cannot take credit for this at all. This is truly the efforts of the group, and especially Kevin McNabb at Grey County EMS. But our role again was just to say, how can we prove that this is effective? So for the past 12 weeks since the beginning of this project, what we've been doing is collecting weekly stats for all these services. And we've also been meeting on a weekly basis since about the end of October, just talking about how things are going on the ground, what's missing, what we need to add. So we're calling that our operation and logistics team that really sort of helps to improve the operations. And what Public Health's doing is recording all of that. And we've developed what we call a logic model. So that's basically a simple term for it's a work plan for the group, is just stay on track, understand what each other are doing, but also probably the most important thing to prove a concept is our evaluation framework that we're just about to roll out as well to the larger group. And basically what this is in order for this to continue and to get long-term funding, that sort of thing, we need to say this. So all of our metrics or all of our measurements, we need to understand what we need to continue to prove that this is effective and this is a beneficial model of health delivery. So that's really from a public health lens, we're trying to capture all of those pieces to eventually apply for funding, as a project group to say, this is needed long-term and this is our application because of X, Y, and Z. We just really want to prove effectiveness. And I think there's always those stories that come out, the success stories that come out, but to prove that in numbers is sort of a very powerful tool to secure funding for long-term service.
We've been hearing about human resources and especially healthcare resources as a challenge these days. And you mentioned a variety of people who are there, including nurse practitioners or nurses or doctors. So where do the human resources come from? They
come from all over. I'm just honestly back in July when the incident happened in Hanover, overnight we had over a dozen agencies step up and they were on the ground the next day. The same thing for this. I'm going to miss folks. I really wish I wouldn't, but same thing. It's in kind right now. These are organizations that are basically saying, you know what, this initiative is so important. I want to dedicate 5 hours a week of human resources to support this initiative. Top of meetings that happen. So again, from the beginning, nurse practitioner for rapid access and addiction medicine has been on site responding, supporting those most in need with substance use challenges. So a big shout out to Grey Bruce Health Services for their support. From the beginning as well, I mentioned Kevin McNabb, Grey County and Grey County EMS. Grey County Housing have been critical in supporting this as well, having housing individuals on site. YMCA, they're always at the table, always involved in providing tremendous support. And I mentioned earlier as well, United Way and Salvation Army have both been instrumental in making sure that our individuals, again, most in financial need, have the access to hats, anything needed to sort of stay warm and safe, along with this being provided by OSHARE here in Owen Sound. So as well to them. And then we also have family health teams at times that will jump in to support with a physician. Grey Bruce Health Services has also sent an addictions physician, especially to support through the holiday season. We were able to operate these right through the Christmas holidays by folks that were willing to sort of dedicate their time during that busy time as well. And police services are also, there to not enforce anything at all, but they're not necessarily on site, but they're always supportive of the initiative that is going on. Same in Hanover, because the police there also have a very wonderful relationship with the clients that we typically do see or frequent the mobile outreach.
Yeah.
Wikidon as well, Friendship Center is part of this group as well. Again, just to ensure that as Indigenous clients do come and access our services, that lends the appropriate care is available to them as well. SOHAC is also at the table from a project standpoint. Yeah, basically, it's a collection of agencies, and all of this is in kind. So it's volunteered to the cause, basically. I think our long-term goal, obviously, is to have a dedicated project team, staff dedicated, funded to support this long-term, because the vision can grow. We call it spread and sustainability. This vision can grow to be able to not just respond in these 2 locations, but to spread out throughout all of Grey Bruce. So those that are most in need in the smaller villages also may have access to some sort of mobile service to provide support to them as well. So that's the future vision, if we can prove this concept and get some sort of application approved for future funding as well.
And certainly you raise such an important point. There's the combination of what people are saying and hearing versus the statistics, and it all creates perspective. But often funding is based on statistics for sure. Since it started in October, any surprises, anything you didn't expect, or any, and that could be a positive, negative, whatever.
I think, honestly, the biggest thing was the amount of folks that wanted their vaccines. It was, we were there for a certain purpose, but then recently, actually, lines started developing prior to opening, and they're all individuals that wanted their vaccine. So it was a great surprise. I mean, there were some challenges associated with the lines and whatnot that we dealt with as a group and made sure everyone got their vaccines. But sort of folks showing up that, our I guess, ingrained stereotypes wouldn't envision those individuals showing up. But then when you talk to them, it's like, well, I can't get to the pharmacy. I can't get to a vaccine hub. And those are people also that we're definitely trying to target, because if not, the choice would be not to get vaccinated. So again, it was neat to see a very different demographic show up at some of these, again, just to get their vaccine. But also, I think the unknown things that have occurred are definitely seeing other agencies say, I want in, I want to help, and seeing the amount of support and positive thoughts about this project come forward. And we've just been building this group as time has progressed. So we've even seen municipalities that don't have a service in their municipality want to be involved to say, well, we can bring this to our municipality as well. They want to learn, right? So we're open to having anyone at the larger table to sort of keep up to date, learn about the project, and perhaps advocate when it's time for us to spread and sustain this project long term.
How can the community support you?
Good one. I think what we plan on doing is definitely, once this trial period is over, we do want to do some media and some social media to really let the public understand what was happening. I think what the public can do for us right now is, if you see something going on, ask questions instead of necessarily thinking a negative thing is happening, but go talk, go and ask, what is this? What are you doing? Because there's many things that happen in healthcare that some people don't have a full understanding of. A perfect example I mentioned earlier is the provision of safe drug use equipment or naloxone for people that are struggling with substance use disorders. A lot of folks don't understand why that's happening. So just ask. I think being educated and understanding the reasons prior to sort of holding a negative point of view about something that is happening. A stat I can share is, if we can prevent one case of hepatitis C in an individual by ensuring they always have clean needles, if they are a substance use user struggling with a disorder, if they can prevent hepatitis C, we're saving the system with, fairly cheap needles compared to over $100,000 to treat that person for hepatitis C throughout their life. So a significant savings by preventing illness as opposed to treating illness. So that really is the goal, trying to get ahead of this, ahead of illness, ahead of infection, so that we can prevent and ultimately save the healthcare system a huge amount of dollars.
Yeah, and we are all learning the importance of our health system and how we need to make sure we have enough care available for people who need the care. So certainly, you make a very valid point. For some money, we're able to allow hospital beds or services to be available for those who might need it. So there certainly is an advantage to that, and we're all aware. I think at this point, with the news about the hospital beds being tight and cancellation of surgeries, how important it is that our system stays sustainable and able to meet the needs of our community, for sure. Do you accept donations?
United Way does. So I think our partners accept donations. So as a mobile project team, no, not as a group itself, but all of those support services that are on site, so places like United Way, Salvation Army, they definitely will all take donations. OSHARE as well. I forgot to also mention Safe and Sound has been integral in this project as well here in Owen Sound. They've been really supportive. Obviously, they offer the service just down the street. They're there all the time. So a lot of clients that we see are just one day a week. But having Safe and Sound available is basically ensures that we can let them know where they can go when we're not there. And that is absolutely critical. And obviously that organization has done worlds of difference for downtown Owen Sound.
Not to put you on the spot, but you mentioned earlier about what can people do, and you really encourage getting informed. What I'm sort of reading behind this, and I hope you might speak to this, is sometimes it's an attitude adjustment to recognize that we're all neighbors. And you know, there will be those who say, well, why in our downtown? Or what would you say to that, Ian?
I would say the same thing, why in our downtown to a dentist office. I would say the same thing, why in our downtown for a bookstore. Because there's a need. You know, we don't turn, as humans, as caring healthcare workers and caring individuals, we never turn our back on anyone. You know, our job is not there to judge. Their job is to care and make sure that, yes, people may burn bridges, but ultimately when it comes to life or death situations, which a lot of these individuals are in, we won't turn our back, right? And the service needs to be available, even if perhaps we're not understanding or agreeing to what the service is providing. And it's okay to not agree. It's totally okay. We all have different points of view and different ways of, you know, agreeing to things. But ultimately, I think it comes down to if your son or if your daughter were in a position that they needed help and they had nowhere to go, would you be upset that we opened a door for them? And I don't think any one of us as parents would ever say that you saving my daughter or son from an overdose or from homelessness or from freezing on the street is doing something bad. You know, we're there because we're human. I mean, that's what it boils down to. We care and we're human, and everyone deserves the exact same amount of service. Some people need more.
Yeah.
Called equity.
Yes. Thank you for that. I'm wondering if you would mind speaking a little bit more about some of the other services. In the information that you had sent, you know, we talk about you know, service being provided to long-term care residents, First Nations clinics, retirement homes as part of outreach through EMS and paramedics. And you know, you talked about taking the service to the people. And that is another example, I believe, of taking the service to the people. Maybe you can, because it isn't always just downtown, is it?
No, it isn't. I think a perfect example, where we don't have too much time, but a perfect example of how EMS are doing just that to support our vaccine efforts here in Grey Bruce. There's people that can't get out of their homes, right? And those individuals still need their vaccine because they have grandkids, they have sons and daughters that come and visit them. So EMS have actually been integral in going into people's homes to vaccinate those that can't get out. So that's another example. It's not necessarily part of the mobile project, but it's part of the vision of what we have here in Grey Bruce, making sure that people have access to services, right place, right time for that individual. And if that's in their home, they have access to home care. And now, you know, throughout COVID, we've been able to see how it's possible to provide more services as well in their home.
You're probably able to see how many more minutes are left on the screen. I haven't been able to see that, so I'm hoping that you'll have to tell me when I need to be.
We're about 10 seconds, I think.
Thank you, Ian. Thank you for being on the program as well. I've appreciated this. And thank you to our viewing audience for joining us here on HealthLink. And
call the Rogers TV viewer response line. Email us or connect with us on social media.